Hi, I'm Dr. Mark Jagger, creator of The Spine Specialist, with another frequently asked question. Quite often we get patients come into our office saying things like, "Doc, I've got spinal stenosis and my doctor has told me there's absolutely nothing we can do about it." Well, unfortunately, we hear that more often than we'd like, but fortunately, it is actually not the case. There is a lot you can do with spinal stenosis. Now, to take a look at what that actually is, there's a couple different types. Number one is nerve root stenosis. So here you see this little nerve coming out here. This is a disc, bones, nerve. So when things get compressed, and sometimes you get a disc bulge that pops out like that, pushes into the nerve. Stenosis just means that a hole that is supposed to be patent and open has been closed down. So if you get the bone squashing it, that's technically called stenosis of the nerve root. The other place you can get it is actually right up in here, in behind the spinal cord, between the spinal cord and the disc. If the disc pushes out and pushes into the spinal cord, you get spinal cord stenosis. Now, normally you get different symptoms with this. Spinal cord stenosis is often numbness, tingling, and weakness in both the legs bilaterally. When you have nerve root stenosis, sometimes you have pain on one side. Now, it's not always the case, but quite often you have pain on the one side where the nerve is compressed. So what we do to actually treat both of those things is when things are compressed, we actually stretch it out to take the pressure off. So you can see here, if things are compressed and the hole is in a state of stenosis, you can increase the space by stretching it and make that hole larger. So that's how to reduce a stenosis. Quite often, doctors don't have a solution for things like that. We do. This spinal specialist table actually stretches everything out, releases that stenosis, and takes pressure off the nerve root. So if you've got spinal stenosis and you think you might have no chance to get better, I'm here to tell you that you just may have a chance to get better, and we'd like to help you do that. So thanks very much for the question, and look forward to answering more of them.